The hosts and guests on Everything's Messy podcast are not licensed healthcare professionals. The discussions in our episodes are not personalized medical advice. Always consult a qualified healthcare provider for medical guidance. Never delay seeking professional medical advice or emergency assistance because of our podcast. We encourage consulting with a healthcare professional before making any significant health changes. By listening to our podcast, you agree to the disclaimer. Thank you for listening to Everything's Messy. Hey, welcome to Everything's Messy podcast, where we celebrate the beautiful but messy life experiences that most, if not all, people go through. Get ready to embark on an exciting journey through the raw and unfiltered stories of everyday people. Here, we dive into messy realities of life, from making messy mistakes to triumphs and everything in between. Are you sensing a theme? That's right, it's messy. But this just isn't about the mess. It's about finding strength and resilience in the midst of it all. We'll explore how health, fitness, and wellness play a crucial role in navigating life's twists and very messy turns. And we'll challenge conventional systems, because sometimes the most unconventional paths lead to the greatest discoveries. Join us as we embrace the messy, beautiful, and endlessly fascinating stories. Each episode is a testament to the power of our messy journeys and the beauty that emerges from the mess. So grab your favorite beverage, coffee, sparkling water, whatever it may be, and prepare to be inspired. Are you ready? Let's get messy. Hey everyone, welcome back to another episode of Everything's Messy podcast. I am your messy host, Sarah. Okay, so today I'm going to get a little messy. I'm actually going to talk about type 1 diabetes and burnout and Hashimoto's and burnout and really chronic illness and autoimmune disease in and of itself and burnout. Doesn't that sound like fun? I've done a few posts on burnout. I feel like, I've struggled with it. It comes and goes. Sometimes I weather it better than others. But there's a couple of things that I noticed and I became self-aware when I started down the path of getting close to burnout to kind of being able to pull myself back a little bit. First, I want to say, let's not be afraid of burnout. There's a reason it's happening. And especially my type 1 diabetes, my autoimmune women that are out there, even men, there's a reason these phrases are coined. Lately, I've been seeing, a lot of T1Ds talking about it, and they're calling it diabetic distress, which, whatever, call it what you want. I've been one long enough to know that it doesn't really matter what you label it as. It exists, and there's reasons that lead up to it that you might not even see or know or be aware of. So I'm going to kind of get into that today. And really quick, if you did not catch the episode where I'm talking about PCOS and PMOS now as it is called, go back and listen to that. Also, if you are a dancer or a lover of dance, go back and listen to the episode that I did with Hip Hop Tribe, how dance is healing and movement of any kind is just the best that we can do. And I've got another great guest coming up next week, also did in person, and her name is Jessica, and it's just going to be a great messy story. And so I hope you'll listen to that as well. All right. So burnout, chronic conditions, autoimmune disease. Let's talk about how can we recognize as we start to burn out. I'd love to say how can we recognize before we get to that level, but listen, I'm not here to blow smoke up your ass, and I don't want to blow up mine. I am telling you at some point in your autoimmune journey, you're going to have burnout. You just are. And it's okay. And I'm here to say you will survive. Sometimes they're really, really bad. Sometimes there's not too bad. Sometimes you recognize it. Sometimes you won't, and you're distracted. What I think I was able to do for me is I definitely started to catch I was getting more short with my family. I didn't have the patience that I once did. And this happens over a while. This isn't just overnight and then wham, I'm right into burnout. I can see it almost like I'm watching a movie. I can see how it develops. And part of that frustration, obviously, especially with T1D, comes with I can do the exact same thing The exact same thing every single day. My workout the same, my meals the same, my, stress level, whatever my workload might be, the kids, everything could be identical. And I'm still going to have at some point a high blood sugar or a low blood sugar out of nowhere. And it's like, WTF? Where did that even come from? I did the exact same thing. And that's just T1D, right? We just know that because, I mean, we can go take a shower. We can not eat the cake, but even look at the cake. And whether that's an adrenaline response or an excited response, and we see the cake, and somehow that is going to affect our blood sugar. And it's not, we do everything in our power to make sure we're controlling that, but we cannot possibly predict and or control all of the components that we know that go into stabilized blood sugar. We just can't. We just can't. Like I just mentioned, going and taking a shower, realizing that if you just took your insulin and you go take a hot shower, that actually makes the insulin work faster because everything opens up. All of the blood vessels and arteries, they all dilate because you're having this hot water, which means, boom, you could have a low right after you get out of the shower. So we can track it. We can see how that's going to happen. But a lot of us are not going to go take a cold shower because, oh, yeah, by the way, the cold shower is going to spike our blood sugar because now everything has constricted and now our heart is pumping faster. So now we're going to have some cortisol release. So now it's going to be high, right? And these are extreme things that I'm talking about. We can go outside and take a walk, nothing stressful. And depending on what sugar you started with for that walk, could go low, could go high. It doesn't make sense, right? You could even have a snack. You could have eaten. You could have pre-bolused. All of these things, the frustration and then inevitably the burnout comes from trying so desperately to make all of the numbers make sense, and they just don't. And that's where we have to get good with, and not to be cliche, but to extend grace to ourselves, to keep focused on consistency, not perfection, and just be in control of the things we can control, right? We know we're not going to eat the cake. It's not bad that you want to eat the cake. And if you are going to eat the cake, you're going to make sure you take enough pre-bolus so it doesn't spike you, or you're going to make sure you go exercise afterwards. So these are daily, minute by minute decisions that most people in their lives don't have to think about, not on the level that we do. We have to become the mathematicians. We have to become the decision makers of everything that affects all around us, which is everything, right? From the simple go out with your friends to go to work to take a nap to whatever the thing is going to require a few steps. And when I say few, it's probably going to be a lot more steps to then make that okay to appease the blood sugar, right? To appease the blood sugar gods who are going to decide, is it going to go up or going to go down? Now, again, if we're consistent, hopefully our A1C is measuring that, and that's great. But again, the A1C is measuring what's happening in our blood. Okay, what's going on in the rest of our body? Are there other things, T1D being an autoimmune disease is going to, I don't want to say 100%, but it's almost 99.9% guaranteed that you're going to have some type of autoimmune disease, because once the cells start attacking each other, they just keep doing that. So in my case, T1D, Hashimoto's, and then of course heart disease. Now, people are saying, okay, heart disease isn't an autoimmune. You're right, it isn't, but it was directly related to having autoimmune diseases that made the plaque build up and the arteries constrict and all of these things, right? So the burnout part of it, the piece of it, that is 100% normal. It's 100% normal. And again, when you can see like a movie, the things leading up to it, being shorter with my family, almost having, I know that I am 100% completely into the K-hole of burnout when my mind starts telling me, what does it matter? It's going to go up anyway. What does it matter? And not in a 80-20 rule. I'm going to live my life and just go ahead and accept that this is how it's going to be. No, because that's the healthy way. And I do that. Absolutely. But when I'm in burnout, the dialogue is more, who cares? I'm so tired of having to worry about it because the incessant having to make a decision, the fatigue of deciding, do I want to eat that piece of pizza? Now, most of the time I don't. Most of the time I don't. But like other people who are on a health journey, on a wellness journey, if they want to have a cheat day, those that don't have autoimmune or blood sugar issues or anything like that, they can go ahead and eat that piece of pizza and not think about it again. Even if it's just Hashimoto's or maybe lupus, maybe RA, even if you're dealing with that, you know, with the piece of pizza, that gluten's going to get you. The, refined carbs, that's going to get you because the carbohydrates, if we don't burn it off, turns to sugar, and the sugar is what is help attacking. It's the cells that, they're feeding off the sugar, right? It's not just deciding today I'm gonna having a cheat day and I'm just gonna have a piece of pizza. It's not that simple for us. It is not that simple for us. And most of the time, positive mindset, we know what we're doing and why we're doing it. And so it's okay. We continue with our consistency and we allow ourselves, okay, today's going to be that piece of pizza. But that's going to come with more insulin. Insulin, we know as a hormone, makes us fat, especially if it's not getting into our cells properly and being utilized properly. I mean, again, it's this whole just dynamic that swirls around in all of us that have to deal with this. And yes, it gets exhausting. Yes, it does. There is no way around it. And I am not discounting anyone who may feel fatigue or burnout for any other reason, because it's, again, your body's trying to tell you something, you're in it for a reason. But I am suggesting that there is an added layer to it when you do have an autoimmune disease. It's just the truth. It's just the truth. There are a lot of things that have to be considered when we don't want to play nice. When we don't want to do the things we know we have to do. It's not because we don't want to survive. It's not because we don't want to take care of ourselves. It's not because we haven't seen the proof and the numbers and all of the A1Cs and time in range and all of that stuff. Of course we want all that. But it is the ongoing heavy just that sits on you and weighs on you, and we don't get a break. We don't get to take when we go on vacation, my husband will tell you, in order for us to go on vacation, I require 2 other bags that are not even fun vacation related. It has all my insulin, all my supplies, all my backups, all my blood sugar, all of the snacks, that's all just so we can go on vacation. That's a lot. It's not just, "Ooh, I get to go on vacation." It is making sure that I have enough pump supplies, that I have enough insulin pens if I want to take a break of the pump, that I have enough CGMs if one dies or doesn't work or whatever it's going to be, on top of that backup of having the blood sugar machine, because if the CGM fails, we got to have a backup. It's incessant. Now, that's life. I have accepted that. I'm not fighting against it, and I'm certainly not a victim because of it, but I can say it's a lot. It's a lot, and sometimes I'm just done with it. And so for those of you who are feeling like that, for those of you that are feeling that burnout, again, even with Hashimoto's, you've got to consider the gluten, you got to consider the flare up, you got to consider the joint pain, you have to consider the fatigue and the brain fog that comes along with absolutely somewhere the TPO antibodies are not talking to the the TSH isn't talking to the the T3 isn't talking to the T4, and now we're just stuck. And of course, I'm exaggerating a little and I'm throwing out the thyroid terms and they're not connecting and they're not supposed to. It's a point. It's an exaggeration to illustrate kind of thing. But it's still the picture that I'm trying to paint is it's a lot. It's a lot. And those who do have the luxury, and there's nothing wrong. I'm so glad you do. Those that do have the luxury, they can just pick up and go on a whim. I know in other ways, in whatever facet of their life, they could be exposed to burnout as well. So I'm not saying woe is me, and I'm certainly not saying, oh, aren't you so lucky? I'm just saying burnout is real. Burnout affects us. It is something that we cannot escape. We can have the best positive mindset. Positivity absolutely does help and work. But sometimes we just want to say, shut it down. I just cannot process any more information. I cannot think and make any more decisions. My friend and I, we joke, having to think about what is for dinner every single night for the rest of our lives was not something that we signed up for. Okay. We just having that decision alone, I think I saw a meme. It said something like deciding what ethnicity the chicken is going to be every night is just too much, right? Am I going to make, teriyaki chicken? Am I going to make shredded taco chicken? Am I going to make, chicken parmesan? Like every single night, there is a decision that is layered into, of course, I get to cook for my family. I am blessed and I'm so happy and I'm not complaining about it. But it's one more decision, right? It's one more thing that's piling on. And so when we take a step back and we say, recognize, okay, I'm feeling a little off. I'm feeling a little less patient. I'm feeling a little less want to care about something. I'm feeling a little less, I don't want to make dinner. I know this is starting to set me up for going through the motions of burnout. And there is no expert timeline that says not only how long does it take for burnout to set in, because it's not just going to be a one and done thing. And there's no expert timeline that says how long you're going to be in burnout. Those are all very unique and specific to you and what you're going through. Okay. What we need to first do is sit in those ugly feelings, in the messy waves that it just sucks right now. It's okay, but it just sucks right now, right? If we blow past that part, if we try to guilt ourselves or will ourselves or tell ourselves, you're feeling this way, but you don't need to be. And I understand. I understand feelings are not facts. I understand that. Especially with women, we sometimes get our judgment clouded with, you know, all of the emotional and hormones and everything that we're going through. Although I will not say, I don't know that that's unique to women because I have seen men, definitely have man periods. And that's all I'm going to say about that. So when we, have to deal with something so monumental every single day, you have to allow yourself that breath, that one quiet time to just say, I'm in burnout. I accept it. And just sit in it for a minute. Don't rush to what the next step is. Because I know, like me, nobody wants to be a victim. Nobody wants to stay in these icky feelings. But if we don't sit in it for just a little bit and acknowledge it and actually let our body rest and say, you're right, body, I'm sorry, we need a break. And, from that, your mindset will start to change because your body will start to trust you that you're listening to it. Hey, messy warriors. So, if you're looking for some help, some guidance, how can I get back on track? Maybe you're newly diagnosed T1D or are a parent of a newly diagnosed child of T1D. Check out my website. There's lots of stuff that I'm offering, lots of support. Look, the T1D world is so much to unpack. It's going to take a long time to get in and settled. So if you need some help, reach out, let me know, and I'm happy to start you on your journey, or maybe you need some guidance on how to make a better plan. Whatever it is you're looking for, check out everythingsmessywellness.com. And as always, keep it messy. You're giving your body that break it needs of just, I need to sit and just unplug from all of it. Whatever, again, lupus, RA, Hashimoto's, MS, there's so many things out there. And they predominantly do affect women. I'm not saying that men don't get chronic illness, but the the percentages for females to get an autoimmune and chronic illness is way, way higher than for a man. There's a lot of thought into that. We carry the load. We have a bigger mental load. We carry all the day-to-day stuff, not discounting or putting down anything that men do. It just seems for women, and I think this has to do with the present day for sure. We are processing and deciding and funneling everything in a 24-hour period that our ancestors did maybe over a lifetime or certainly a longer span of time than when we're doing in a day. And our nervous system isn't built like that. It is not meant to process and carry what we do on a daily basis. It just isn't. And look, I get it. We're hustlers. We're out there being boss women. We are out there trying to take on the world, and all of that's great. But if we don't make a plan and have active breaks built in, and we burn ourselves out until there's no flame left, sometimes these are the results, and we have to figure it out. Now, for T1Ds, there is no rhyme or reason. There is no, and I wouldn't say that is gender specific. That does cover both genders. And they can't figure it out. They can't, they know what happens when it does happen, but I've heard it all from it's environmental to it's a virus, your body's, got tricked and didn't know it was killing off its own good cells, to it's trauma, it's stress, it's, you went through a traumatic thing, to, oh, maybe a family member has it. There's a lot of, yeah, could be, but there's not a direct streamline as to why. And now the information that we're getting and the things that are coming out from that is now there's things that we can take if people are tested early enough, you can almost put it into remission for a while. And then of course the islet and other things that they're happening in other countries where they're essentially curing T1D. And, these patients are proclaiming that they're not on insulin anymore. So it's out there. It's just not mainstream. Doesn't seem to be reaching where it needs to be reaching. But I do think it's very promising on the people that do get tested early, especially the children. There's TUDCA, TUDCA, and other things that you can start to take to help support your body that kind of keeps it dormant for as long as it possibly is going to be. Great. However, once it does come into full effect, these are the things we have to deal with. And nobody really understands what it's all going to entail, right? I'm 30 plus years at T1D and I do not have it all figured out. What I can figure out, what I can accept, what I can control is recognizing the signs of burnout. And because I've gone through it before, I've sat in that mess. I've allowed my body to take its break or, maybe cry about it, feel bad about it, give my body that rest, take a beat. And from that, my perception starts to shivot a little bit. That's shift and pivot. I like to make up words. It shivots a little bit where my mindset is now able to kind of wake back up and say, okay, what is my next step? I don't want to sit in this anymore. I gave it what I needed. Now I'm going to gather up my strength and I'm going to change my mindset to go forward and start over, right? Because that's all we can do. But if I didn't allow my body to sit in the mess and be mad about it, right? What's that mean? Be mad? I'm going to be mad for a minute. I might be sad for a minute too. But if I don't allow my body to do that, and I just guilt it and say, keep going, keep going, keep going, keep going. You don't, there's no room for this. You have to make room for it. You have to recognize it. That shifts your perspective. That changes your mindset. We shift it into, okay, what's next? What do I do now? What's my next step? So for me, because again, like I said, I've been through this with burnout. When I got to the part where my mindset was starting to shift, I started to make a plan of what am I going to do for my body to make sure I'm checking in with body and mind and spirit to maybe delay the next burnout. And I'm going to make a plan. What does that look like? Does that look like, a day somewhere, just me? Does that look like, doing something with friends? Does it look like my husband and I doing whatever? I make sure that I build in these little breaks to hopefully delay a burnout a little bit longer, right? But if I didn't sit in that mess, I can't see it clearly. So sitting in the mess actually starts to let me see it clearly, changes my mindset. And from that mindset, I get to my moment. I get to the point where, okay, now I'm going to start over. I've sat in these icky feelings. I've sat in the mess. Now I'm going to take all of that, the mess, the mindset, the strength from the mindset, and now I'm going to have my momentum. And I'm going to start back slow. We are not talking about perfection and racing and going back all the way we were before the burnout. I'm going to start back slow. I'm going to add things back in slowly. I may not add everything that I was doing before the burnout. I'm going to take it one step at a time. And that's okay. And that's what my body can handle. That's what my mind can handle. And that's how I'm going to hopefully, again, I'm not going to prevent it completely. It's going to creep back up again because, like I just got done explaining, there's just too much and too much to process and too many decisions to make on a minute by minute basis. It's going to come back. But I'm going to have this plan and I'm going to take some power back. Even if it might seem fake at the moment, I'm going to feel like, okay, I've got it together again. I'm back, able to handle what I can. Make sure that I add in the movement. I'm going to make sure I add in the, breathing. I'm going to make sure I add in the, you know, better nutrition. All of these things are going to go back slowly, but not in a way where I'm going to beat myself up about it and obsess about it. And that's part of the issue I really believe before the burnout. We really get we get so caught up in all of it. And it's really hard to take a step back and say, okay, wait. You don't have to go perfect to this, or you don't have to beat yourself up because you had a bad blood sugar. I don't know about you. I always think, where did I mess up? What did I do wrong? Sometimes I didn't do anything wrong. Sometimes it's just blood sugar, and that's what being a T1D is about. So if I give myself some grace and I make sure that I don't attack myself, it's these little nuggets, these little things that we leave as a trail. So when the next storm comes around, it's okay. And specifically, let me just get to Hashimoto's for a minute. There is and I've talked about this before, there's a level of fatigue with Hashimoto's that is undescribable. And I, for the longest time, was beating myself up, just telling myself how freaking lazy I was. But come to find out, my body was screaming of the inflammation and the brain fog and the gut that was just not processing anything, depleting nutrients, not being able to process anything. My body was just, and it's still, ugh, Hashimoto's is a whole other world. And I feel like when you go to the doctor, you go to your endocrinologist and the doctor says, well, your labs are fine. I don't know why you think you have thyroid issues. It's fine. That's wrong because, and I've said this before, remember the blood tests are testing in between the levels to see if you have a sickness. It's not testing optimal levels. So if you still feel off, you are probably off. Just because it's not showing up severely low or severely high does not mean it's not running optimally. And that's the part that doctors, I feel, they're missing. They're missing this. What is the best for you? And a lot of times we are quick to say, you know, well, I just have to eat better. I just have to exercise more. Sometimes that is the case, but sometimes it's overstimulation, dysregulated nervous system, unable to give yourself, the bandwidth to operate on what you need to be doing. It's a perfect storm, right? It's just not going to go anywhere. And then you add in can't have the gluten, have sensitivities to this. This makes me have a flare up. Now I didn't get any sleep. Now it's because I'm having a flare up that I can't get sleep. Now I'm having cortisol spikes. Now I mean, it's just tick, 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 all these things. And again, we get frustrated, especially if you are doing all the right things, right? This is the hardest part. I think this almost makes burnout happen even more because if you are doing all the right things, right? You are consistent, you are following the plan, and sometimes it's still not working out. That's what's gonna just we're just gonna go crazy over that. Because again, we think it's something that is in our control that we can do. Maybe it is, maybe it isn't. But if we don't sit in that, if we don't make it okay for us to just be mad a minute, be sad a minute, that is what is going to perpetuate more burnout. So, and again, the idea isn't to completely stop the burnout from happening. No, no, it's going to come. The idea is to maybe keep it to where it's not going to be a severe crash out. And maybe it takes us 2 months to get out of burnout. No, we want to make sure that we have the burnout, we have the crash out, but the crash out isn't as extreme because we've put these other things in place. We know we're going to allow our body to go ahead and sit in it. It's almost like once you give in, it's almost like that you're ready to go to the next step because you gave in, you quit fighting it. You kept that negative dialogue in your head from putting you down and saying, I need to not, guilt me out of this. I need to go keep pushing, keep pushing, keep pushing. That can't always be the case, especially in those with effed up nervous systems. Hello. So, and I don't know, I don't have the answers as far as do this and you're going to be great. No, but I don't gatekeep what I have done that has worked for me. I want it and hope that it does work for you. And I want to hear how you sat in it because we can't gloss over that part. Just like we can't gloss over the mindset part and we can't gloss over the momentum part. All of those things go synergistically together. And the point is recognizing it a lot sooner when that burnout is going to creep up again. And it will, because it does. Because right now there is no cure for T1D. There is no cure for Hashimoto. Now, we can make Hashimoto's go dormant. That is the goal, right? To keep it so in check and keep that monster locked up. But if you have leaky gut, if you have like all of these other things that are happening with the Hashimoto's, it's going to be a minute. It's going to take a minute to figure out, got to back up all the way. Okay, now I have this flare. What did I eat? What was I doing? What am I not doing? It's going to take a minute. So I say all of that to say burnout is real. Burnout is okay. Burnout is going to happen. What are you going to put in place to make it just a little bit more palatable to handle? And what are you going to do to make sure you can recognize it the next time it rears its ugly head? Because it's going to. So again, my 3 M's: sit in the mess, let it change or shivot your mindset, your perspective, and use that to get your momentum. Again, it's not going to happen overnight. You got to be nice to yourself. That's one of the other things I've learned too. You have to be nice to yourself. I always say grace. Yes, give yourself grace. But what does that mean? That means be nice to yourself. That means go ahead and sit and rest. Be nice to yourself. Let your body learn it's allowed to rest. Right? I read something the other day that they say it was gate kept, and I don't know why. I mean, I'm sure I do. It has to do with the money issue, but there's something about the Navy SEALs, and it could be any soldier, but I thought it was specific to Navy SEALs. They would run cold water on the inside of their wrists after being in combat or after a very, high adrenaline, event that they were in. The cold water on your inside of your wrists immediately lowered cortisol and lowered your heart rate. But this information was gatekept by the army or the military or whatever it was because they were heavily giving medicine prescriptions for people who were dealing with, combat and traumatic events. Okay. Now, I do not know that just the cold water will cure you, but in the moment, this one thing you can do that'll bring your heart rate down and that'll bring your cortisol levels down. It's got to help somehow. It's got to help a little bit, but I don't know why it has to be gate kept. So they came out with it now. It's not gate kept anymore, which is great. If because it's something so simple, I feel a lot of people be like, yeah, that's bullshit. Maybe I'm gonna try it. I'm gonna try it and see. I encourage you to try. I mean, people say, "Oh, taking a cold shower or splashing water on your face, same thing." Yes, but there's not there's not sometimes the opportunity to do that if you're out in public. You can run the cold water on your wrist. Maybe it helps. Maybe I read something the other day as well that said, I mean, you know me, I'm a data nerd, so I'm always reading. Um, if you crunch your toes, right? If you curl your toes for 20 times, it will take you out of the maybe fight or flight or the nervousness or whatever that you might be feeling because it uses muscles that you don't use every day. We don't think to curl our toes every day. We stretch, but curling toes are very specific. This is supposed to just snap that one little brain part and it's supposed to just say, okay, you're okay. You're okay. And I don't know what the relevance is of the 20 times. Maybe that's just what your brain needs to have for registration of it. But hey, these little tidbits I'm willing to try. It, again, could be placebo, could be voodoo, could be all bullshit, but why not? Why not try it and see? And make sure, you're actively taking that data in and did it do anything? Maybe not. But it's the same concept of trying to, whatever that looks like for you. Could it be bullshit? Maybe. But I know for me, being able to become aware of when the next burnout is going, I know how to get in front of it. I'm still going to sit in that mess, but I'm going to make sure that I'm being aware of these things that I can do to not draw it out, to not be in a funk for 6 months, which I have been there. And I'm not saying that's not okay, but we definitely want to try and shorten that, make it better, and get us out of that mindset and back into the world and doing the things. The 80-20, again, not perfection, consistency. Not perfection, consistency. So that's what I have for you all today. And I'm anxious to see if all of those hacks work. Oh, also, really quick, just a reminder, the T1D baddies out there. Sure, most of you know this. I was a late comer in learning this. A couple of years ago, I think I learned it, but I just thought I like to share the little nuggets again. Remember that when you are eating fat, we know what the carbs do. We know we have to pre-bolus enough to cover the carbs so we don't get the sugar spike to 250. We know that. Whatever your carb ratio is, if you're using a pump, whatever, if you're using the pins, you know what your sliding scale is. We know that. But it's starting to become more mainstream. But for those that don't know, when you're eating fat, a steak, a hamburger, something like that, the fat will increase your blood sugar hours later after you had it. So there's talking about now, I think on Risely Health, they talk about this and a couple of other diabetic platforms. But what they're saying is you want to use that delayed bolus, right? Where you can take a little bit up front, but then you're going to have the remainder of it a few hours later. And that's really, really important. We're getting into summertime. We're having barbecues. Eat the fat. That's fine. But just remember, don't be in that position where at the end of the day, you're like, all I had was protein. Okay, well, if you're eating hamburgers, there's going to be fat in that. If you're eating steak, ribs, pork chops, whatever you're having, there's going to be some fat in that. Make sure that you are factoring that in when bolusing and make sure understanding that that fat is going to be delayed. Sometimes, 3-4 hours, it'll have a spike that much later. So you want to make sure that you're getting that extra bolus at the end, when it's that time. So anyway, just wanted to share that little nugget and I will get this information out to you. If you have questions, let me know. I'd love to know what you're doing for your burnout. We're all in this together and there's no judgment. And remember, it's okay. And until next time, everybody, keep it messy. Thanks for listening to Everything's Messy podcast. Whew, if you made it this far, give yourself a gold star or at least a nap. Honestly, if you showed up today and you were listening, you've already crushed it. I'm so grateful for you listening. If anything hit home, share it, tag me, write it on a sticky note. I don't care. Just don't keep all of this messy goodness to yourself. You can find me on Instagram at Everything's Messy Wellness or over at my website, everythingsmessywellness.com, where I've got resources, coaching, and probably a new rant about blood sugar or something that's just nonsense. It's all waiting for you. Check out my YouTube channel. I've got all of my podcast episodes up there. And I'm on X at Everything's Mess. Or if you just want to send me an email, Sarah at everythingsmessywellness.com. Look, until next time, hydrate, take no crap, and as always, keep it messy.